Tonight, CBS New York investigates families of medical malpractice victims promised a lifetime of care by the state, but the fund for that care is running out of money.
CBS 2 investigative reporter Mahsa Saeidi asked the state how it plans to keep that promise, and she's here now with more on her investigation. Mahsa.
Good evening, guys. The chair of the Senate Finance Committee tells me that when this deal was conceived in 2011, the plan was to have hospitals largely finance this fund. The state won't reveal how much hospitals are putting in each year, but it's definitely not enough. State records show the fund is facing a projected shortfall of at least $3 billion, and that shortfall is impacting the children.
At birth, Chase Sadowski suffered a neurological injury, severely impairing his motor skills. Now 17, for Chase to get from one level of the house to the other, two aides have to carry him up and down the stairs. A lift paid for by New York's Medical Indemnity Fund is broken. Chase feels trapped, and he blames the fund.
It's hard to put into words the emotions that I feel, besides straight anger, because of how much was taken from me.
Typically, patients who sue for malpractice and win get a substantial award. But in New York, the hospital or doctor found to be negligent is only on the hook for part of the damages. Instead of paying for future costs, New York enrolls these kids into the fund with the promise of a lifetime of care.
I just feel we were lied to.
Chase's dad, Walter Sadowski, says long before the lift broke in 2020, the fund approved an elevator stating it's medically necessary. But the costly project stalled, as did modifications to Chase's car.
Where's these environmental modifications? Where's these vehicular modifications? I don't get to spend that much quality time with my son because I'm too busy fighting for the things that he needs. Good.
Other families complain about reimbursements. David Diaz says services like transportation are being denied for his daughter, Judalise.
Good.
Every year it gets tougher and tougher to get the same services we're getting now.
There's no new investment.
The New York Department of Health oversees the fund. During a state budget hearing in January, Senator Liz Krueger asked DOH about the future.
We have a legal obligation to the children that are in the fund for the rest of their lives. What's happening?
We have not stopped enrollment, and if we did, we would notify you as well as others.
But 4 months later,
Why wasn't anyone told?
DOH quietly stopped enrolling new applicants. Families tell CBS 2 they found out by reading a notice on the state's website. Governor Hochul's office says she put $58 million into the fund to reopen it until next spring and provide necessary support to impacted families. According to Senator Krueger, in 2011, hospitals lobbied and agreed to largely pay for this fund as a way to curb skyrocketing insurance costs. But the $58 million just transferred didn't come from hospitals. It came from you, taxpayers.
We still desperately need malpractice cost reform.
Laura Alfredo is with the Greater New York Hospital Association. Records show in 2012, hospitals began contributing at least $30 million into the fund.
It's not a dedicated funding stream.
Should it be?
We've been very clear since this all happened in May that we are open to talking about alternate ways of funding the MIF.
Now the fund needs more money as additional children are injured by malpractice. CBS 2 asked DOH for statistics on birth-related injuries. Are babies safer now than before? The state pointed to initiatives to create safer birth experiences, but shared no data.
Are hospitals doing enough to crack down on doctors who make mistakes?
There's certainly more to be done, but there are lots of reasons for bad outcomes.
Senator Krueger says it's time for all the stakeholders to discuss the fund's future. She's proposing a public roundtable.
I would really love to see a commitment from the governor that her agencies will be there.
It hurts to see what is happening to these kids that can't even speak for themselves.
And the state says that it cannot comment on specific cases due to patient privacy. Meanwhile, we're told that Governor Hochul wants to work with stakeholders, but her office would not commit to that public roundtable that families so desperately want. In 2017, guys, lawmakers increased reimbursement rates to providers. It's something that families really love, but it's put extra strain on this fund as well.
So when the new enrollment stopped, what happened to the kids who were already in the fund?
So they still were able to go to the doctor. They still were able to go to the therapist. They got their services. But as you can imagine, with so much unknown right now, they're very nervous about the future. What's going to happen next year?
So painful.
A promise was made. This was not their fault. It wasn't their family's fault. The state needs to be responsible for this. Mahsa, thank you for laying all of that out for us. It's a complicated subject, but you did really, really well explaining everything. Thank you.
And holding them accountable.
Yeah.
Bottom line. Thank you.
Thanks, Mahsa. If you have a story for our investigative team, send an email to CBS2investigates@cbs.com or call our tip line at the number on your screen.